Welcome to Spotlight. Around the country, the growing conversation about poverty often focuses on one fundamental question: is our official poverty measure doing a good job? At Spotlight, check out our commentary series, Poor Measurement, and all the other resources that can help you figure out how our government determines who is and who is not officially poor. Also, Congressman Jim McDermott plans to reintroduce a bill that would modernize the poverty measure. So when you finish watching this webcast, be sure to watch the congressman as well. Today on Spotlight, we want to welcome three experts on the national scene: Mark Greenberg, co-founder of the Georgetown Center on Poverty, Inequality, and Public Policy, and senior fellow at the Center for American Progress and the Center for Law and Social Policy. And with a city focus, Mark Levitin, Ph.D., Director of Poverty Research, New York Center for Economic Opportunity. And from a congressional viewpoint, Indi Gupta, staff U.S. House of Representatives, Committee of Ways and Means, Subcommittee on Income Security and Family Support. Mark, let's start with you. What is the official poverty measure?
The official poverty measure is the statistic that the government uses each year to provide an announcement of how many people are poor and the characteristics of who are poor. It's a figure that's reported annually, and basically what it does is it uses what are referred to as thresholds. It sets a dollar amount of income, and if you're below that dollar amount, you're considered poor. If you're above that dollar amount, you're not considered poor.
So what's outdated about it?
So the original measures were put in place in the 1960s, and really the only change that's happened since then has just been adjusting for inflation. So the original measure is now outdated in a lot of ways. First of all, the poverty thresholds are quite low. They are roughly, for a family of four, about $21,000 a year, and many people believe that the amounts families need to meet their basic needs significantly exceed that. It's also basically an arbitrary figure. Back in the 1960s, it was set because there was research then that said that families spent about a third of their income on food, so they just took an amount for food, multiplied by 3, and created the measure. It doesn't really represent anything now. And then the other, in my view, major problems with it are that it doesn't consider a lot of things that we ought to consider when we're looking at family resources. For example, it doesn't consider the effects of tax policy, either tax liabilities or credits. It doesn't consider the benefits from food stamps or housing assistance. It also doesn't consider people's costs for things like health care and child care and work expenses. So it's not a very good measure of resources matched against a threshold that is deficient in a lot of ways.
And we've been talking about changing the official measure for years, but Mark Levitin, New York has gone ahead and done it. How did they do it?
Back in 2006, Mayor Bloomberg asked a number of prominent New Yorkers to come together and to propose ideas for reducing poverty in the city. And the conversation among them quickly became, well, what is it that we're really trying to reduce, and how do we know what works? And the poverty measure should give us good information about both questions, and it doesn't, for just the reasons that Mark outlined. So when the commissioners made their report to the mayor, they said, you should innovate along these programmatic lines, but in addition, the city should develop its own measure of poverty so that we really know where we are. Otherwise, we're lost.
Can other cities or states of different sizes adopt the New York City plan?
Yes. We use the American Community Survey as our principal source of data for our data work. And that survey provides an annual sample for any city of over 65,000 people. So the data's there, and we're quite happy to help anybody follow our lead and go ahead and develop their own measure.
Did you follow the National Academy of Sciences?
Yes, we did. To the extent it was possible, given the data available to us, we adopted that methodology. The NAS gave us two tools we needed. One was that we needed a way to develop a set of thresholds that were realistic for New York City. And the NAS measure provide a methodology for doing that. And the other thing is that it provides a way of accounting for the resources that we want to see included in a poverty measure, like tax credits, like the value of food stamps or housing assistance. So it met our needs, and it also, I think has helped contribute to a growing ferment at the grassroots that we really need to make this change.
Indy, how does the bill Congressman McDermott plans to reintroduce modernize the measure?
Well, the Measuring American Poverty Act basically focuses on all the concerns that have already been raised about the official poverty measure. First, the bill adopts a method similar to what New York City adopted, which is based on a National Academy of Sciences report from the mid-1990s, and changes the threshold. The new threshold would be more consistent with public opinion and our understanding of what it takes to meet basic needs. Then the bill redefines resources. What income is available in a household to meet these needs? And the bill takes into account a lot more of the taxes and transfers that help households meet, in particular, their food, clothing, and shelter needs. And then finally, the bill also adjusts these thresholds for various differences in needs, including differences based on varying cost of living across the country, and differences based on family size, and also differences based on housing needs, which can vary, for example, based on people who, when you compare people who own their housing outright versus those who have housing payments to make.
Mark Greenberg, the Center for American Progress issued a report From Poverty to Prosperity. How did you approach poverty, and did you use the current official measure in that report?
So the report that you just referred to is a task force report where a task force was asked to come together and look at what could be done to dramatically reduce poverty in America. And as the task force met over the year, initially we really weren't focused on the poverty measure because we wanted to focus on what are the policies that are going to make the biggest difference. But as we put forward a goal of cutting poverty in half for the nation, we then wanted to have a way of measuring whether we were accomplishing what we were proposing to do. Mm-hmm. So we sought to have a set of our recommendations modeled, and we squarely faced the problem that the existing measure doesn't pick up the effects of policies that would make a very big difference in improving people's lives. As we've talked about a little, if you expand tax credits, it doesn't matter in the existing measure. If you expand child care assistance, it doesn't matter in the existing measure. So it became clear that we needed a better measure in order to pick up the effect of policy, and so we ultimately wound up using something that was not exactly what the National Academy of Sciences put forward, but was really drawn from their recommendations in order to be able to better demonstrate what our proposed policies were accomplishing.
Mark, let's talk a little bit more about the New York measure. What did the new measure say about poverty in the city?
Well, it said one thing, which is there's more of it than we thought. Under the official measure, 18% of the city's population in 2006 is poor. Under our measure, the CEO measure, it's 23%. I have to say, I think that's the least interesting finding in the report. Much more interesting is how poverty changes within the population. So on the one hand, we see, for example, that child poverty is actually a bit lower using our method. In particular, it's lower for children who are living with only one parent. So we're picking up in our measure the help that those families are getting through tax credits or food stamps. So we're seeing some of what we want to see in a poverty measure. On the other hand, big increase in poverty among the elderly, and that is a result of their high medical costs.